Did you know that medical marijuana, otherwise known as cannabis, is technically legal in the state of Texas? However, it is incredibly difficult for patients to obtain it due to federal regulation. Hi, I'm Morgan Giles, and after doing extensive research, I have gained a lot of knowledge on medical marijuana. And medical marijuana has a lot of benefit in the medical field and could even be beneficial to yourself or a loved one in the near future. And this is why I believe that the government, both federal and state, should regulate medical marijuana because it is safer than prescription opioids and it helps patients deal with mental and physical pain. So to start off, I'd like to talk about the legality of medical marijuana, and then I'd later like to explain how the drug can be safer for patients than opioids and how it can help them both mentally and physically. So to start off, it is incredibly important to understand the impact of that unlegalized medical marijuana has on patients and doctors. So since we all reside in the state of Texas, it is important to note that medical marijuana is legal in Texas. And the benefits of medical marijuana are abundant in the medical field, yet the drug continues to be difficult to acquire in Texas due to the government's regulations. And under the CSA, the CSA does not recognize the difference between recreational and medical use of marijuana. Therefore, the CSA considers medical marijuana a Schedule I narcotic alongside cocaine and heroin, and thus having no value in the medical field. And in Gonzalez versus Rich in 2005, the United States Supreme Court held that the federal government had the authority to prohibit marijuana for all purposes. Thus, medical marijuana patients may be prosecuted by federal law enforcement officials even if they reside in a state where medical marijuana is legal. And doctors are also under strict regulation when it comes to prescribing cannabis. This is due to doctors being fearful of prescribing a Schedule I narcotic and their DEA license being revoked. So now that we've talked about the difficulties that patients and doctors face with unlegalization of marijuana, I would like to share the laws of federal and Texas laws. So it's important again to know the current laws in Texas where we reside concerning medical marijuana. So in 2015, Governor Greg Abbott passed the low THC bill, Bill 339, and this states that strictly qualifying patients may be prescribed by 2 certified specialists. And 4 years later, Abbott signed House Bill 3703, which expands the program to a wider array of patients with more conditions. So now that we've talked about the legality, I would like to talk more about the medical benefits. So many ways medical marijuana can benefit. There are so many ways that medical marijuana can benefit the medical field and also can be beneficial again to yourself or possibly even a loved one. And it is also used for a very good substitution for many prescription opioids. And this is because opioids can be potentially harmful to the patient due to abusage, overuse, and even overdose. And according to Daniel Butwitz, a medical professor, he states that it's important to be cautious with all medications, but it's especially important to be cautious with opioids because these drugs are easy to overdose on and one high dose pill can kill. And according to Marcus Bachner in the article Medical Cannabis Laws in 2014, approximately 60% of all opioid overdoses occur among patients who have a legitimate prescription from a single provider. And also, Marcus Bachner states that since the release of medical cannabis, there has been a 14% reduction in opioid prescriptions and a 24.8% reduction in the annual rate of opioid overdose deaths. So there are so many physical and mental conditions that medical cannabis can help, and some of these conditions are Alzheimer's disease, Crohn's disease, eating disorders, epilepsy, glaucoma, and even multiple sclerosis. And there's been a huge breakthrough concerning cancer with medical cannabis, and this cancer Medical cannabis helps cancer when patients are going through chemotherapy. It helps kill cancer cells, slow tumor growth, and improve weight gain due to appetite loss in cancer patients. Although cannabis is highly effective in the medical field, it seems as though state-level legalization of medicinal marijuana has raised a concern about the accessibility to adolescents. However, the impact in the scholarly journal, The Impact of State Medicinal Marijuana Legislation on Adolescent Marijuana Use in 2014, author Esther Chu states that the increases in adolescent marijuana use related to legalization of medical marijuana throughout the United States has not gone up. So I hope you have a better understanding of the legality of medical marijuana and the benefits it has to patients for mental and physical conditions. So I believe that the government, both state and federal, should make it easier for medical marijuana to be obtained because it is safer than most prescription opioids and because it can help with physical and mental pain with patients. And if the federal government were to legalize medical marijuana, it would allow Texas to conduct new laws concerning the disbursement of accessibility to the drug. And so the best way to make a change is the best way to make a change and legalize medical marijuana is to plug into advocacy organizations that are driving the change, and also donate to nonprofit organizations. And you can even get in contact with politicians such as Governor Greg Abbott by calling him or even emailing him directly. And while taking the considerations of the negative connotations that come along with medicinal marijuana, it may be easy to disdain the drug. However, with all the benefits that marijuana possesses, it can be incredibly useful to medicine. Thank you.